Dehydration baby symptoms. It's a true fact that only adults get dehydrated, right?
Nope.
No, not right at all. Okay. Well, the reason that my special guest knows this is she is Dr. Jamie Bohlman. Hello, doctor.
Hello.
And then we also have my wife, who is a licensed massage therapist, and we're going to be talking about dehydration baby symptoms. What are dehydration baby symptoms?
So as a pediatrician, this is what I deal with, whenever I'm working and seeing patients. So, when a baby comes in, there's only a few things that we are looking for, but number one is their hydration status, and how they're, are they irritable? Are they urinating fine? Are they eating fine? Are they having any vomiting? Because the babies are so small and their organs are still kind of immature that they have a very low reserve for getting dehydrated. And dehydration, undetected and untreated, can actually lead to death.
So, how do I know if my baby is showing symptoms of dehydration?
So, number one, they would, you might notice that they're irritable. And these are things that you might not think about because, what baby doesn't cry? But,
right.
If they're not eating too well, if they're not urinating, when you go to change their diaper after feeding them and it's dry, then that, is a big sign that they're getting dehydrated and they need to be seen.
Seen by a pediatrician?
By a provider who is, competent with seeing kids. Yes.
So I know that we don't deal with babies in our massage therapy, but do you have any thoughts as it relates to dehydration baby symptoms?
As far as the system, the one thought I was wondering about was bowel movement. You talked about urination, but if they're having a difficult time with bowel movement, would that also be a sign of lack of water?
Yes, for sure. And so bowel movements usually come a little bit later after, urination. So urination would be a more sooner one, but bowel movements would come later, yes.
So if we are having trouble with bowel movements, then we have progressed beyond the beginning stages of dehydration into some more advanced?
Yes. Yeah, that works for adults too.
Okay. So as long as I'm having one bowel movement a week, then I know that I'm definitely dehydrated enough, right?
Hopefully you're having more than one bowel movement a week.
So what kind of frequency should be, especially for a baby, what kind of frequency should we expect?
So that is a little bit of a tricky question. When you're a newborn, that first month, of life, and you're being breastfed, we say that, anywhere from 7 times in a day to once in every 7 days can be within that range of normal. So it's a little bit hard to see, but the baby otherwise should be acting well, and the stool should be very soft.
So urinating is one way to understand dehydration baby symptoms. Bowel movement is another. Can we do that skin test with a baby?
For sure. So babies, they can't speak yet. So sometimes people say pediatrics is kind of like veterinary medicine. Your patients don't talk to you. But, the babies, talk in other ways. They would cry a lot. You might kind of reach up here in their fontanelle. If it's sunken, meaning that, when you feel, the scalp right here, if you feel that there's a little indentation, that, is also, an issue. If you start to kind of pinch the skin or even push on the skin a little bit and it doesn't have that nice bounce back, you can also see that. Their mucous membranes might be, dry, so if they're crying, you don't see a lot of tears coming, then that could be a sign of dehydration as well.
So tears, urine, bowel movement, skin test. Now, you kind of went over the skin test a little bit quickly. Let's go ahead and back up to that. How can a parent or guardian do a test with a baby's skin in order to understand if they are exhibiting dehydration baby symptoms?
So, we all love to hold babies, right? Because they're so soft and, and their skin is so smooth. And so if you start noticing that their skin is not so smooth, if it becomes like that kind of like a, like flaky, if you notice that, that when you touch it, it's kind of like dry and leathery, those are not good signs. And so you want it to be nice and supple. If you push on it, it should not, bounce back. If, sometimes you kind of pinch just a tiny bit and you can see, and that's what we call skin turgor. And if it tents there, if it stays, like tented up, then that's not a good sign. That means they're dehydrated. And one of the very, very, very last symptoms before you really are in danger is that the baby will become very sleepy. And so if you notice that your newborn is just not waking up at all and they're just sleeping, they're not a good baby. That means that they are, they could be dehydrated.
Sure. Now, we've been talking a lot about the newborn aspect and whatnot. Is there a age factor gauge measurement that so from newborn to 6 months, or where this is how we can tell a symptom at this age? This is that progressively through that infant's.
Well, pretty much a lot of the symptoms that we talked about are not age dependent. You might notice that, adults, when they get dehydrated, they're very irritable. They're grumpy, and stuff. Also, their skin shows the same kind of issues. Very dry, very, the skin turgor is not very good, doesn't bounce back. Their urination, their stooling also decreases too. I would say that probably for, if we're only talking about infants and babies, is this, fontanelle. By the time you reach 4 months of age, this, anterior fontanelle closes. And so that's the only thing that you can kind of see, for babies that you might not see for adults.
So what about those lotions that we put on the babies and whatnot? Can those actually lead to dehydration baby symptoms?
It can, actually. And so a lot of those, if you have a lotion and it is able to rub on very easily, it's because there's little alcohols that are in there. And if you've ever, cooked with alcohol, or if you've ever seen, alcohol, you notice that it evaporates a lot faster than if you had water. And so that's the same thing on the skin too. It evaporates more, so it actually pulls moisture out of the skin. This is, we as pediatricians deal with eczema quite a bit.
Okay. Thank you for that. Irene, do you have things you would like to add as it relates to dehydration baby symptoms? I know this is not...
Not that I'm thinking of, but I'm wondering, holding the baby in water when it's dehydrated, how the absorption through the skin, would that work just as well?
I would think so. Baby's skin is very, very, porous. It's very, thin, and stuff. So it's very, very important, that we have the right temperature. So you don't want the water too hot, or it actually can also draw water away from the skin as well. But, warm water, would be okay. But they do lose a lot of moisture through their skin, a lot more than we do as adults. And so you might want to be careful about that, but you can.
Okay.
I find that intriguing because an adult is out giving physical exertion, they're out being active and doing some stuff that cause sweating and whatnot. I know nothing about this field of dehydration baby symptoms. I work with adults within the massage therapy processes, but it would seem that adult that is sweating is going to actually lose more fluid than the baby, but you're suggesting the other way around.
Yes, babies, their skins are very, very thin, and so they lose a lot of moisture through their skin.
Awesome. So as it relates to dehydration baby symptoms, is there anything else that we should add to our knowledge on this video?
Just one last thing is very important, is that babies less than 6 months of age, their kidneys are not quite developed yet, so they cannot handle the free water, meaning water, just plain water without any extra additives. So if you do have a dehydrated baby, probably the best thing to do is to give them something like Pedialyte, which has, water. It's mostly water with just a little bit of added salts and just a tiny bit of sugar. Nothing like our Gatorade. Gatorade has too much sugar for kids, but Pedialyte would actually be much more of a body homeostasis type fluid.
Thank you for that. Well, join us next time when we take yet more look at the topic of dehydration and its effects within massage therapy, both for young and old and everyone in between.